What's the difference between a psychopath and a sociopath? Most people think they know the answer. Movies tell us that psychopaths are cold, calculating masterminds. Sociopaths are portrayed as reckless, explosive, and unpredictable. But how accurate are these stereotypes? And does psychology actually define these two groups the way Hollywood does? Today, let's separate fact from fiction. 1. Neither is an official diagnosis. Here's something that surprises many people. The terms psychopath and sociopath are not official mental health diagnoses. If a mental health professional evaluates someone with these traits, they're more likely to use a diagnosis called Antisocial Personality Disorder or ASPD. ASPD involves a pattern of disregarding other people's rights, breaking social norms, manipulating others, and showing limited remorse for harmful actions. The terms psychopath and sociopath are often used to describe different patterns within that broader condition. 2. The common traits. Before looking at the differences, let's look at what they have in common. People with strong antisocial traits often struggle with empathy. They may manipulate others for personal gain. They may ignore rules or social expectations, and they often have difficulty feeling guilt after hurting someone. Of course, every person is different. Not everyone with ASPD behaves in the same way, and not everyone is violent or dangerous. That's an important misconception to clear up immediately. 3. Sociopaths tend to be more reactive. When people use the term sociopath, they're usually referring to someone who acts impulsively, someone who struggles to control emotions, someone who reacts quickly when angry, frustrated, or threatened. Their behavior may appear chaotic. Relationships can be unstable. Outbursts can happen suddenly. They're often easier to spot because their emotions tend to show on the surface. 4. Psychopaths tend to be more calculated. Psychopathy is often associated with a different pattern. Instead of acting impulsively, these individuals may appear calm and controlled. They often think ahead, plan carefully, and avoid drawing unnecessary attention to themselves. Some psychologists describe psychopaths as emotionally cold rather than emotionally explosive. Because of this, they can sometimes appear charming, confident, and socially skilled, at least on the surface. 5. Why they're so difficult to identify. One reason psychopathy fascinates people is that it can be surprisingly difficult to recognize. Many people imagine a criminal or a villain, but real life isn't always that obvious. Some individuals with psychopathic traits function normally in society. They hold jobs, maintain relationships, and blend in with the people around them. Their behavior may only become noticeable when you look closely at how they treat others. 6. Nature vs. nurture. One of the biggest debates in psychology involves a simple question: Are people born this way, or do they become this way? Many researchers believe both genetics and environment play important roles. Some studies suggest psychopathic traits may have stronger biological components. Meanwhile, sociopathic behavior is often associated with childhood trauma, neglect, abuse, or unstable environments. But human behavior is rarely explained by one factor alone. Most experts agree it's usually a combination of biology and life experiences. 7. What about empathy? Empathy is one of the most discussed differences between these groups. Some psychologists believe sociopaths can experience empathy in limited situations. For example, they may care about certain people while remaining indifferent to others. Psychopaths, on the other hand, are often described as having significantly reduced emotional empathy. That doesn't necessarily mean they can't understand how someone feels. In fact, many can recognize emotions very accurately. The difference is that understanding someone's feelings isn't the same as sharing them. 8. The Hollywood problem. Movies and television have created powerful stereotypes. The genius serial killer, the evil mastermind, the emotionless villain. While these characters are entertaining, they don't accurately represent everyone with antisocial traits. Most people with ASPD never become violent criminals, and many people who commit violent crimes don't have psychopathy. Reality is far more complex than fiction. 9. Can people change? Perhaps the most important question is this: can people with these traits receive help? The answer is yes. Treatment can be challenging, but it's possible. Therapy can help improve impulse control, reduce harmful behaviors, and teach healthier ways of interacting with others. The earlier intervention happens, the better the chances for positive outcomes. That's why understanding these conditions is so important, not for labeling people, but for helping them. The truth is that psychopaths and sociopaths aren't as simple as movies make them seem. Both terms are used to describe patterns of antisocial behavior, but real people are always more complicated than labels. What matters most isn't whether someone fits a category. It's how they treat the people around them. Because at the end of the day, behavior tells us far more than any label ever could. So, what surprised you most about the difference between psychopathy and sociopathy? Let us know in the comments.